Good morning, everybody. My name is BJ Hancock. I'm a pediatric surgeon and pediatric intensivist in Winnipeg, Manitoba, Canada. I'm one of the two Canadian regents on the Board of Regents of the American College of Surgeons, and it's very much a pleasure to speak with you today. We're in very challenging times. In just a few weeks, the world has changed. These are unprecedented changes where extraordinary measures have been required to dampen the progression of COVID-19. It's brought many challenges for patients and families who are confined to their homes, as well as for those involved in the delivery of healthcare to those in need. We do need to encourage that people seek early attention for medical care when they are sick, rather than trying to stay at home and delay attention to medical matters that are really important. But at the same time, we need to be prudent about resources of healthcare that have limitations. The decision to terminate all elective surgery was the right thing to do. But now, as the burden of disease starts to flatten, we are exploring the avenues that need to be taken to slowly increase surgical activity. The ACS published guidelines in a joint statement about a week ago that have provided valuable information for increasing surgical activity. The American College of Surgeons has been a tremendous resource of up-to-date information and guidelines for all surgeons and stakeholders in healthcare. Despite the many limitations that COVID has brought upon us, there have been many positive changes as well. And as folks adapt and search for innovative ways of living and adapting to the restrictions, and as surgeons seek for alternate ways of delivering healthcare to their patients, we've had some good changes. There's been an increase in virtual patient care where we've been able to meet with our patients by telephone and telemedicine. Feedback that we receive from patients and families has been extraordinarily positive, where they have really appreciated the contact and the ability to stay at home while still receiving some medical attention. There's been a tremendous increase in virtual meetings and rounds, which has increased attendance and dissemination of knowledge. And I think that those are going to stay with us as time goes by. The expectations that patients and families have in the delivery of healthcare and communication strategies will be long lasting after COVID has reached its peak. We will never go back to the normal that we knew. And I think as time goes by and we move forward, we will need to find a new normal and seek out new ways of delivering healthcare, of delivering surgical care, and of following our patients both pre and post-operatively. Some of the advice that the Canadian government had given at the beginning of all of this was to stay home, to stay well, and to stay in our own bubble. And I think that we should continue to do that and to explore ways of keeping our part in dampening the curve of COVID. Thank you very much. I've enjoyed meeting with you today. Thank you.